This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, May 19th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Best Practices for Hospital-Based Initiation of Medications for Opioid Use Disorder, a Consensus Statement. This survey study used a 2-round Delphi process to develop expert consensus on best practices for hospital-based MOUD initiation for patients with OUD, with a goal to provide guidance on changing inpatient addiction treatment in response to increased synthetic opioids in the unregulated drug supply. A total of 42 expert clinicians participated. Clinicians were considered a national expert if they had cared for at least 100 hospitalized patients with OUD in the last 2 years. There was a consensus that buprenorphine and methadone initiation in the hospital setting were appropriate, with less support for hospital-based naltrexone initiation. Consensus was also reached to support rapid methadone initiation, high and low-dose buprenorphine initiation, and provision of non-MOUD full agonist opioids for treatment of opioid withdrawal during methadone initiation as a bridge to buprenorphine initiation and for those declining MOUD. Next is an article also in JAMA Network Open and is titled Psilocybin in the Treatment of Cocaine Use Disorder, a Randomized Clinical Trial. This study investigated the effect of psilocybin on cocaine use disorder, or CUD. Participants were randomly assigned to receive either a single dose of psilocybin or diphenhydramine. Both groups received cognitive behavioral therapy for CUD. Urine drug screens confirmed abstinence during the follow-up period of 180 days. At 90 days, 55% of the psilocybin group remained abstinent compared to 21% of the placebo group. Complete abstinence was more common in the psilocybin group, and participants in this group had a reduced risk of lapse. Adverse events occurred in 65% of the psilocybin group and 10% of the placebo group. None were serious, and most were during the drug administration day. The authors conclude that psilocybin is safe and effective for the treatment of CUD and call for studies with larger sample sizes. Our next article is in Alcohol Clinical and Experimental Research and is titled Predictors and Trajectories of Negative and Positive Interpersonal Dynamics in Remission from Alcohol Use Disorder. AUD can result in negative interpersonal interactions due to increasing harms to others and pressure to change. This study charts the evolution of interpersonal dynamics during AUD and during a 12-month follow-up. Positive interpersonal dynamics are measured with emotional support and friendship self-report scales, and negative dynamics with hostility and perceived rejection scales. The study enrolled 501 participants with AUD who were entering treatment or making a recovery attempt outside of treatment. At 12 months, 17% were in abstinent remission, 18% were in non-abstinent remission, and 66% were not in remission. Negative interpersonal dynamics decreased most in abstinent recovery, less in non-abstinent recovery, and less still for those not in remission. Positive interpersonal dynamics did not increase regardless of outcome. Our next article is in JAMA Network Open and is titled Cost Effectiveness of the START Hospital Addiction Consultation Service for Opioid Use Disorder Treatment. This economic evaluation of 325 patients assessed if a hospital-based addiction consultation service, or ACS, is cost-effective for increasing the initiation of FDA-approved medication for opioid use disorder in the hospital and linking patients to follow-up care after discharge. Researchers found that a hospital-based ACS was cost-effective compared with usual care. From a health sector perspective, the ACS was associated with an incremental cost of $162 and 0.0103 quality-adjusted life year gained per person, leading to an incremental cost-effectiveness ratio of $15,750 per quality-adjusted life year gained. These findings suggest that the hospital-based ACS was a cost-effective way to improve care for hospitalized patients with opioid use disorder. Next is an article in Addictive Behaviors and is titled Functional Impairment During Sustained Remission from a Substance Use Disorder, a Cross-Sectional Population Study. It is unknown if long-term remission from SUD is associated with daily functional impairment. Researchers used the World Health Organization Disability Assessment Schedule, or WHODAS, to assess functional impairment among those in long-term SUD remission versus those with no history of SUD, and found higher impairment scores among those in long-term remission and who were less likely to report no impairment. However, upon additional analysis, researchers found higher WHODAS scores were associated with prior year severe psychological distress and for people who received mental health treatment. This accounted for most of the increased score among those in remission. Authors note a third of people in remission reported no functional impairment, highlighting potential for high quality of life among those with SUD, but there is ongoing need to address psychological stressors in this population. Our next article is in Frontiers in Public Health and is titled Association Between Current E-Cigarette Use and Chronic Obstructive Pulmonary Disease, a meta-analysis focusing on exclusive e-cigarette users. E-cigarettes are often viewed as alternatives to combustible cigarettes with less harm, but long-term consequences are still unknown. Researchers conducted a meta-analysis including 15 studies to assess any association between e-cigarettes and chronic obstructive pulmonary disease, or COPD. Overall, current e-cigarette use was associated with increased risk of COPD, as was prior e-cigarette use. In subgroup analysis, researchers also found that e-cigarette use alone was associated with increased risk of COPD. Dual use of both and current e-cigarette use plus former combustible cigarette use were also associated with increased risk. These findings support the need for increasing public awareness of potential risk associated with e-cigarettes. Next is an article in the Journal of Addiction Medicine and is titled Response to Correspondence on, quote, Precipitated Withdrawal Following Emergency Department Initiated Buprenorphine, a Retrospective Study. In reply to a letter which argues that the reported 6% rate of precipitated withdrawal highlighted in the article Precipitated Withdrawal Following Emergency Department Initiated Buprenorphine, a Retrospective Study, may not reflect the true incidence because of major retrospective study limitations, the authors of the original article state their goal was to estimate how often precipitated withdrawal occurs after emergency department initiated buprenorphine in real-world practice. They acknowledge that retrospective methods, missing CAL scores, and uncertain opioid exposures can bias the estimate in either direction. They explain that restricting analysis to patients with complete data raised the rate to 12%, showing how much missing data can change the result. They also note that excluding continuation therapy patients was necessary because they have a different risk profile and would likely distort the estimate. Overall, precipitated withdrawal is an uncommon but real risk that clinicians should understand so that they can use buprenorphine more confidently. Our final article is in the Canadian Journal of Addiction and is titled Innovative Transitions from Methadone to Long-Acting Injectable Buprenorphine in Individuals with High Tolerance to Fentanyl, a case series. This is a case series of 3 patients who transitioned from methadone to long-acting injectable buprenorphine, or BUP-XR, using innovative patient-centered prescribing techniques. In case 1, a 30-year-old woman who was taking methadone and using 1 gram of fentanyl daily was transitioned to slow-release oral morphine for 3 days, then received 300 milligrams of BUP-XR on day 1, followed by a second dose on day 8. In case 2, a 27-year-old man with multiple comorbidities who was on 70 milligrams methadone daily received 300 milligrams of BUP-XR 3 days after discontinuing methadone. In case 3, a 40-year-old woman who was taking 200 milligrams of methadone and 7 grams of fentanyl daily received 300 milligrams of BUP-XR 48 hours after last methadone dose, with repeat doses at day 8 and 21. All patients also received a sublingual buprenorphine taper in addition to initial BUP-XR doses. All 3 patients were stabilized on BUP-XR with retention for over a year in treatment and improved management of medical comorbidities. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.